CEN Certification Exam video. Question 1. A patient presents with sudden onset pleuritic chest pain and shortness of breath after a long flight. The nurse's priority is to assess for myocardial infarction, pulmonary embolism, pneumothorax, asthma exacerbation. Question 2. A patient presents with urticaria, angioedema, and difficulty breathing after receiving 4 contrast dye. The nurse's priority is to administer diphenhydramine, administer epinephrine, start in 4, call a code. Question 3. A patient presents with severe, tearing abdominal pain, a pulsatile abdominal mass, and hypotension. The nurse suspects acute pancreatitis, ruptured abdominal aortic aneurysm, bowel obstruction, appendicitis. Question 4. A patient presents with altered mental status, meiosis, bradycardia, and copious secretions. The nurse suspects organophosphate poisoning. The treatment is naloxone, flumazenol, atropine, and pralidoxime, activated charcoal. Question 5. A patient presents with a high-pressure paint gun injury to the hand. The nurse's priority is soaking the hand in warm saline, icing and elevating the extremity, preparing the patient for surgical exploration, administering a digital block. Question 6. A patient presents with a painful, swollen, and red leg after a minor injury. The nurse notes warmth and tenderness along the vein. This is most consistent with deep vein thrombosis, superficial thrombophlebitis, cellulitis, muscle strain. Question 7. A patient presents with acute onset of tearing chest pain radiating to the back, along with a blood pressure difference of 30 millimeters of mercury between arms. The nurse suspects acute myocardial infarction, aortic dissection, pulmonary embolism, pericarditis. Question 8. A drowning victim is brought to the ED. The major physiological insult is hypothermia, pneumonia, hypoxia, dysrhythmia. Question 9. A patient with type 1 diabetes presents with vomiting, abdominal pain, and a serum glucose of 650 milligrams per deciliter. The nurse anticipates the following laboratory finding: respiratory alkalosis, metabolic alkalosis, metabolic acidosis, normal anion gap. Question 10. A patient develops a sudden, severe headache described as the worst headache of my life, along with nuchal rigidity and photophobia. The nurse suspects migraine headache, tension headache, subarachnoid hemorrhage, meningitis. Question 11. A patient is placed in 4-point restraints for violent behavior. The nurse's ongoing responsibility includes documenting the behavior requiring restraint, ensuring a physician's order is obtained, providing regular monitoring and release of restraints. All of the above. Question 12. A patient in the ED is in ventricular tachycardia without a pulse. The nurse's priority intervention is administer a miodaron 300 milligrams for push. Perform immediate defibrillation with 120 to 200 J biphasic. Start chest compressions. Establish an advanced airway. Question 13. A patient taking sildenafil, Viagra, 2 hours ago now presents with chest pain. Which medication is contraindicated? Aspirin, nitroglycerin, morphine, atorvastatin. Question 14. A patient with acute psychosis is becoming increasingly agitated and making verbal threats. The nurse's priority is administering antipsychotics, 1-to-1 observation, Placing the patient in a seclusion room. Contacting security. Question 15. A patient presents with an opioid overdose with respiratory depression. The nurse should administer flumazenol, naloxone, activated charcoal, atropine. Question 16. A patient with a history of alcohol use disorder presents with confusion, ophthalmoplegia, and ataxia. The nurse suspects hepatic encephalopathy, Wernicke's encephalopathy, alcohol withdrawal, meningitis. Question 17. A patient presents with a swollen, bruised leg after a blunt injury. The nurse notes tense compartments, severe pain on passive stretch, and paresthesia. The nurse suspects deep vein thrombosis, compartment syndrome, cellulitis, rhabdomyolysis. Question 18. A patient with known borderline personality disorder presents with superficial wrist lacerations. The nurse's priority is providing emotional support, suturing the wounds, assessing for suicide intent, discharging the patient home. Question 19. A patient involved in a high-speed motor vehicle collision presents with hypotension, abdominal distension, and a positive FAST exam. The nurse anticipates emergent CT scan, immediate laparotomy, observation in the ED, administration of vasopressors. Question 20. A patient presents with a sudden onset of right-sided weakness, facial droop, and slurred speech. Last known well was 2 hours ago. The nurse anticipates emergent CT scan of the head, administration of aspirin 324 milligrams orally, continuous cardiac monitoring, all of the above.